Good afternoon. I'm Lainie Rutkow, Vice Provost for Interdisciplinary Initiatives at Johns Hopkins University and a professor at the Bloomberg School of Public Health. I'll be moderating today's briefing. I'm pleased to welcome you to this installment of the Johns Hopkins Congressional Briefing Series, where Johns Hopkins experts provide a briefing on a topic of interest to policymakers and engage in real-time Q&A. Today, our panel will discuss innovative approaches for helping America's school children to excel. Fall is a time of inspiration and excitement as tens of millions of students across America return to the classroom, supported by dedicated educators and proud family members. But, as we know all too well, the U.S. educational system confronts major challenges. To mention just a few, school closures and disruptions caused by COVID-19 have negatively affected the academic achievement of students, and children who already face disadvantages have suffered the greatest harm from the pandemic. Many regions around the United States are facing major shortages of teachers and school staff. Teachers are navigating increased ideological divisions and polarization over curricula content and classroom instruction. Health disparities, mental health challenges, and chronic absenteeism continue to negatively affect the academic achievement of far too many school children. Today's briefing will highlight these challenges, but just as important, it offers an opportunity to discuss innovative and evidence-based approaches for addressing them. I'm delighted to be joined by four of my Johns Hopkins colleagues today. Dr. Odis Jensen is a Bloomberg Distinguished Professor at the School of Education, the Bloomberg School of Public Health, and the Krieger School of Arts and Sciences. He is Executive Director of the Johns Hopkins Center for Safe and Healthy Schools. Dr. Jensen also directs the Institute in Critical Quantitative, Computational, and Mixed Methodologies. His work examines how neighborhoods, schools, and public policies affect youth development, the status of African American populations, and social inequality. Dr. Annette Anderson is Deputy Director of the Johns Hopkins Center for Safe and Healthy Schools, an Assistant Professor at the School of Education, and co-founder of the eSchool Plus initiative. She is a native of Baltimore and a graduate of Baltimore City Public Schools. Dr. Anderson has served in a variety of school-based positions, including classroom teacher, teacher leader, curriculum coordinator, assistant principal, and chief executive officer and founding principal of a charter school. Dr. Robert Balfans is a research professor at the Center for the Social Organization of Schools at the Johns Hopkins School of Education, where he also directs the Everyone Graduates Center. That center serves as the support hub for the National Partnership for Student Success, a public-private partnership between the U.S. Department of Education, AmeriCorps, and Johns Hopkins University, which was launched at a White House meeting in July. Finally, Dr. Megan Collins is the Allan and Claire Jensen Professor of Ophthalmology at Johns Hopkins Medicine's Wilmer Eye Institute, as well as Associate Faculty at the Berman Institute of Bioethics and the School of Education. Dr. Collins is also Director of the Center for School Health, co-founder of the eSchool Plus initiative, and co-principal investigator on Vision for Baltimore and Vision for Chicago, to public-private research partnerships to develop sustainable models of school-based vision care. Before I turn to each of our panelists for their remarks, I want to remind you that we'll be providing answers to your questions in real time today. So please submit questions for our panelists in the box that you see at the bottom of your screen. I'll now turn to each panelist who will provide a brief overview of key topics, and then we'll move to Q&A. Odis, I'll turn to you first. Could you please discuss some of the ways to redress the impacts of social inequality on schools?
Well, thank you for the introduction. Happy to be here today. In addition to a reflection of where our nation's students are on their knowledge of academic subjects, NAEP proficiency scores are also a report card for policymakers and schools on how we fared in getting kids what they needed to remain successful during the pandemic. And NAEP 2022 data recorded our first drop in mathematics in the history of that longitudinal study. And it's widening gaps along almost all dimensions, but especially for kids who have had limited and those who have had more educational resources during the pandemic. So clearly, it's important for us to first acknowledge that resources are driving a lot of what we're seeing in schools and what teachers are having to contend with. So as before the pandemic, these educational gaps continue to be opportunity gaps, wherein the educational indebtedness our society has to those who have had the least, are minoritized, and are most economically distressed, as they were before the pandemic, were also or are the populations that are in greatest need now. And I think the post-COVID era will continue to be one of inequity and stagnant educational disparities unless we act. Also, teachers are our greatest and least supported educational resource. And after navigating a contentious period in which their personal health was at stake in school mask mandates, they now enter a reality in which LGBTQ book bans, don't say gay policy, curricula about gender and women's rights, CRT bans, and other issues have undermined their professional autonomy, outstretched their training, and put them at risk of losing their jobs. So our teachers have not been equipped to contend with the systemic racism that is behind the CRT bans and other forces of marginalization that are reshaping their work environment and educational opportunity in our nation. So clearly, we need to repeal the CRT bans that undermine the possibility of a common social history. It marginalizes the cultures and contributions of minoritized groups, and it forestalls the racial reconciliation this country needs in order to properly educate the next generation. And lastly, we also need to rethink schools in a way that acknowledges and addresses the inequities that predated COVID, but also imagines and creates the policy infrastructure needed to address the COVID setback. In that, we need to equip teachers to think beyond remediation, providing the educational resources through legislative acts that recognizes the enormity of the challenge, having a whole child and two generational approaches to learning and learning acceleration, because COVID not only impacts schools and instruction, but also families and the well-being of kids. We will need coordination among the Department of Health and Human Services, U.S. Department of Education, Justice, Agriculture, and other federal agencies to create an ecology of care, educational acceleration, and equity to get us out of the COVID crisis and move us toward equal educational opportunity.
Thanks so much, Odis. Annette, I'll now turn to you. What are effective approaches for equitably addressing learning and developmental loss caused by the pandemic?
Thank you, Lainie. Well, I want to build on what my colleague, Dr. Johnson, said a moment ago. We are seeing historic declines in academic progress of our students, and I think we need to really focus on looking at the school as a life course center for families rather than an educational institution for students. If I could see my slides, please. I'd just like to go quickly over to the next slide, please. Thank you. A few of these issues. So as Dr. Johnson just pointed out, our NAEP report for this last term has shown us that there are both historic losses in terms of progress for students in reading and mathematics. And so that's of significant concern to us. The other thing that we are also seeing is that we have significant mental health issues and trauma that continues to emerge as we start to come out of the pandemic. Even though the numbers of suicide attempts and suicides have declined overall between 2019 and 2020, amongst girls in the age group of 12 to 17, the rate of suicide attempts has actually increased 22% in 2021. And the CDC reports that this is likely connected at some level to the pandemic. And so we know that mental health issues in particular are something that we need to deal with more forcefully in our schools. And even though we've gotten lots of ARPA funds into school buildings and district hands, we need to be doing more. The other thing that we're seeing is that there is an increased level of social pressure because our young people are growing up in an era where there is an unregulated amount of social media exposure during this critical period in youth development. And so we see that our young people are having a social media appetite of often 5 to 7 hours or more per day, and that we don't know what the effect of that long term will be on their social growth and development. And then finally, we have sent our children back into school buildings after this pandemic without really addressing a crisis that was happening before it, and that is this issue of safe and healthy schools. Post-Uvalde, we have heard from parents all around this country that there are concerns that continue to be heightened around how safe our schools are. And so we see that we need to do more around keeping our schools safe and healthy. I know here in Baltimore, we have already had in one of our high schools, we have had in 2 weeks, the first 2 weeks of school, we've had 2 tragic deaths at one school. And so we see that there is a lot more work that we need to do as adults to make sure that our schools are both safe and healthy for our young people. Next slide, please. And so as we look at what we need to do to provide supports for students, I want to offer 4 different categories of supports. The first is that we need to really be more intentional about our stopgap offerings. I know that there's been a lot of emphasis on catching students up, and I'm sure you'll hear from some of my other colleagues about that. But we have to be intentional about making sure that that the access for those programs is allowable for every student. We need to focus more as we teach reading. One of the things we need to respond to with this gap in the NAEP scores is a higher intentionality around teaching the science of reading to our young people in the younger grades, and in focusing on comprehension skill acquisition in the upper elementary grades. That's something that there's been lots of debate about in the reading wars, but we definitely need to button up as a country on what our philosophy towards reading is going to be at the early elementary and upper elementary grades. Next, I would say that we need to think about having an expansion of quality training for students who may pursue different post-secondary options beyond college. So having greater access to the trades for our young people as they come out of high school and come through this pandemic is something that we should be spending a lot more time around in terms of the options and the opportunities that our young people have. And then finally, I'd say the district partnerships with local internships so that our young people are getting into the workforce earlier with quality internships that help them to see how to make a livable wage. The next thing I'd say is that we need to increase staffing. Whatever we do in terms of staffing, we have not done enough. We have historic levels of teacher shortages and staffing shortages and things like cafeteria workers and busing. So we need to think about that in terms of how we provide additional staffing there. Also, we need to think about how we provide additional staff in mental health, as well as out of school time programming. The role of the caring adult in our schools cannot be understated. It is not just to the administrator or to the teacher that the role of a caring adult falls. So we need to make sure that we are doing more to provide additional opportunities for our young people to connect with a caring adult. And then having additional pipeline partnerships so that we can hire more of our community members and people that are engaged in the life of a school so that they can continue to be present in a way that makes a difference in our school buildings every day. The third piece that I think is really critical for us to address is this issue around social isolation. One of the things coming out of the pandemic that we have not fully addressed is how much social isolation did our young people really experience, and what was the impact of that? And so one of the ideas that I really think we should dig down into a little bit more is this notion of a social IEP. We have academic IEPs and we have 504 plans, but for a number of our young people, we really need to think about how we can potentially put together social IEPs so that we can measure how our young people are feeling and how they are doing, and come up with plans to help them to feel remediated in the area of social engagement. We also need to focus more intentionally on peer relationship building. A lot of our schools have doubled down in terms of bringing adults in and mentorship programs, but we need to make sure that those programs are connected to outcomes that we can measure. And then finally, I go back to this whole issue around social media. We don't know, because we did not grow up ourselves with social media having such a large presence over our lives, and we need to think about what time limits on social media might do to help to spur more positive youth development. And then finally, as I said earlier, we have to have more significant training for the caring adults in a building. Every adult in a building matters, and we want all adults in the building to really get the training that they need around this village concept of education, also around tiering student well-being, so that there is an early warning indicator, so that our students, when they are not doing well, that everyone in the building is cued in, so that we are all on the same page about how we make sure that every child has a safe and healthy school experience. Thank you, Lainie.
Thanks, Annette. I'm now going to turn to Bob. Bob, could you offer some additional insights about proven interventions to address learning loss and to prevent dropping out and absenteeism? And I'm hoping that as part of your remarks, you could give us a brief overview of the National Partnership for Student Success.
I'll be happy to do that. As you're going to see, we're builders here at JHU, so I'm going to build on my two colleagues' comments here. When we think about sort of that disheartening data they've shared, it really has two main sources. Students experience instructional loss, but they also experience disconnection from school. And those two things together then affected their well-being and their mental health. And this happened then in an environment where all of those things were the strongest and are under-resourced and historically discriminated against neighborhoods. So when you put that together, it can seem daunting, but we do have some evidence-based strategies that can make a real difference. On the instructional loss side, there's clear evidence that it's really a combination of accelerated learning, which Odis and others have mentioned, this idea that we have a poor history in our nation of always saying we have to remediate or slow down or give less than. And really what the evidence shows is kids need rich grade level material with high quality materials. And that has to be supplemented then with high dosage tutoring, which means like 3 times a week, 30 minutes a session with a person that they're staying with all year, and then it's integrated into what's happening in their school day, and extended learning time. And it's really the combination of those that gives us the enriched environment that will accelerate students' learning and help deal with that instructional loss. We know for this idea of disconnection from schooling, there's some really good research, which actually was started in our School of Public Health and has expanded since, on this idea of school connectedness. And it says kids are connected to school when 4 things are true. When they believe there's an adult that knows and cares about them as a person, when they have a supportive peer group, when they're involved in the fancy term is pro-social activities, but they believe what they're doing is helping somebody else. It's not just about them. And they feel welcome in their school for who they are. That's that sense of belonging. I don't have to change for the school to welcome me. I'm welcomed as I am. When that is true, the evidence is clear that this is as close as we get to a universal prevention strategy for both academic achievement and social emotional development and physical and mental well-being. The challenge is that we got good data from the CDC during the pandemic that when students said they even just had that first one, that they had that adult who knew and cared about them as a person, those students reported half the mental health challenges of students that didn't have that. But only half of all high school students and only 1/3 of minority students reported having a relationship like that, right? Showing the significant relationship gap. The challenge we face is our schools were not designed nor staffed, as sort of Annette brought out very well, to provide this level and intensity of supports that's required both from the pandemic, but also from all the structural inequities and under-resourcing that came before it. And to help work on that, there's sort of two national initiatives we're involved in that are trying to do that. The first is the National Partnership for Student Success, which is a public-private partnership between the Department of Education, AmeriCorps, the White House, the Johns Hopkins University through our Everyone Graduates Center, and 95 youth-serving and growing organizations, everything from Big Brothers Big Sisters, the Boys and Girls Club, to the teachers unions, to the principals and counselors associations, and lots of local community groups that work in schools. And the goal for that is to meet the president's call to get 250,000 additional adults working as mentors, tutors, success coaches, post-secondary advisors, in and with and supporting teachers in schools. That sort of that integration again that Annette talked about, that village concept. And we're working to sort of find sources from that through things like, more college work study students involved in that, more employees of large employers, using 12th graders, training them up for this, using the 5 million adults that currently volunteer in school. Even if 2% of them are trained up to do these supports, that's another 100,000 adults doing the work. And then finally, we need to help schools with better systems to figure out how to get the right support to the right kid at the right time. And we've done a lot of work at our center over the years on things that are called early warning and on-track systems, which is basically on this idea that kids signal early and often that they need help. And if you pay attention to those signals, which are things like chronic absenteeism, having trouble failing a class, if you pay attention early, you can be much more effective at helping them than if you wait until they fail a class, or until they're suspended, or until someone sends them to truancy court because they missed so much school. Really being proactive and not reactive. And for that, we have a grad partnership for student success, which is 9 major organizations who've done this work coming together to create sort of the next generation of these systems that are strong enough and robust enough to deal with the pandemic impacts and going beyond. And the last thing I'll say, because I know we have a lot of policymakers on this call, is that these types of student supports, extra adults in schools, good student success systems, the things that Annette and Odis talked about, they've got to become permanent features of school. They're not just a short-term fix for the pandemic. They're things that clearly our kids and our teachers have told us need to become fundamentally part of redesigned schools that enable all kids to thrive beyond the pandemic. So we have to think about ways that we support that beyond the short term for the long term.
Thanks, Bob. And before I turn to Megan, I do want to remind those who are watching, please submit questions for our experts to answer. We'll be moving to Q&A after Megan's opening remarks, and I do see your questions coming in, but please don't hesitate to continue submitting them. Megan, can you talk about effective ways for delivering school-based healthcare to address health disparities?
Lainie, thank you so much. It's an honor to be part of this panel today. As Lainie had mentioned earlier, I'm a pediatric eye doctor at Johns Hopkins, and my work is focused on pediatric health equity and the impact of health on learning. And as you've heard from our 3 prior speakers, there's been substantial disruptions to schooling during the past 24 months, and a lot of attention has been focused on learning loss. What's been less focused on sometimes is the deleterious effects of these school closures on other aspects of child well-being. As we've heard from, especially Annette today, some of the impacts on mental health and physical health. And long before the pandemic, schools have historically been this hub for the provision of many health services for kids. Those include screenings, they include primary care services, they sometimes include vision and dental services. We're going to talk a little bit about vision today, and school-based mental health programs. And especially for students from disadvantaged backgrounds, these programs had been critical in providing access to care. This is important for 2 reasons. What happened during the pandemic is when schools were closed, many of these programs were disrupted, leaving children without a medical home. And second, we've seen a worsening of various health conditions during the pandemic, whether it is mental health related, whether it is vision related from prolonged screen time. So it's important for us to recognize as we're getting back into the classroom that interrelatedness of health and education, and healthier students are better learners. I'm going to talk briefly about some of the work that we have done in terms of bringing healthcare delivery into the school through the Vision for Baltimore program. If I could have my first slide up, please. So Vision for Baltimore is one example of an innovative program that brings school-based vision care directly into the school setting. And just to set the background, roughly 1 in 4 school-age children actually need glasses. Yet we know from our data at Hopkins, as well as many others, that in disadvantaged communities, many kids are just not accessing the care that they need, and there's substantial health disparities. Recognizing this was a challenge in our own community, together with our city partners, Johns Hopkins University established the Vision for Baltimore program. And this involves our Baltimore City Health Department, our Baltimore City Public Schools, our nonprofit optometric provider Vision to Learn, and our eyeglass provider Warby Parker. And what this program does, it's been transformative in terms of actually bringing all vision care for kids directly into schools. This used to be something that parents would need to bring their children into the community for. Instead, now we bring vision screenings, eye exams, and eyeglasses for all students in Baltimore's elementary and middle schools directly into the school setting for them. And as you can see from the slide here, we've had tremendous success since this program started now in our 7th year. We have been able to screen over 75,000 children, provide over 12,000 eye exams, and we're reaching a big milestone for us, delivering almost 10,000 pairs of eyeglasses. Next slide, please. Now, why is this important? As an eye doctor, I obviously think having good vision is important for visual development. But what we can also see from the simulation in the upper left-hand corner is it's not hard to imagine if you can't see the board, you may struggle in the classroom. And we conducted the largest randomized clinical trial in the United States on school-based vision care delivery and demonstrated the substantial benefits that providing vision care through school can have on academics. Now, what we have shown through this is that this is one example of a model where you can bring vision care and healthcare into the school setting and have a direct impact not only on health, but also on vision, or also on learning, I should say. And there are other examples of this with school-based health centers, school-based mental health programs, and dental programs. Moving forward, we need to continue these conversations about the interrelatedness of health and education and continue to promote evidence-based and scalable models of health services that will not only improve our children's health and well-being, but also impact their academic experience. I'd just like to say that one of the values of conversations like today is bringing together all of these stakeholders to this conversation, healthcare providers, educators, and policymakers, so that we can work together developing innovative solutions that will transform health and education for our nation's youth. Thanks so much, Lainie.
Thanks very much, Megan. I'm now going to transition to Q&A, and as I said a moment ago, please, for our audience, continue to submit your questions. We will get through as many of them as we can during the next 30 minutes or so. So for our first question, Odis, given the names of the various centers that you direct, I'm going to send this one to you. What are your thoughts about innovative data collection techniques that could potentially enhance daily decision-making for teachers?
Actually, this may be a better question for Bob, but I would definitely.
I invite Bob to jump in as well.
But I definitely believe that during COVID, of course, we did not do a good job of establishing benchmarks of where our students were. So it makes sense that after this point, we're talking about learning loss and not really seeing where we might have, where that loss may have been situated within, the complexity of schooling. Now, for teachers and for educational leaders, there tends to be a data collection and evidence-based practice that notes student performances, mastery, and then perhaps growth, depending on their particular system that they use. And then, of course, there are usually state systems as well that provide some of these metrics. To the extent that they were implemented and that the data are reliable over the COVID period is debatable. And it's clear that at some point we need to have a conversation about how do we I guess, get back our data vision about this period and understanding exactly what were some of the drivers of performance and how does that knowledge then inform what teachers do in their practice moving forward.
Thanks, Odis. And Bob, I'll invite you, but also Annette and Megan to please jump in. I'm sure you all have different perspectives on this question about data.
Yeah, so just to build on that, and on the sort of innovative idea of it is that, one of the things we know about the pandemic is that everybody experienced it differently, and it's still evolving, right? There's still effects happening, and some of them are going to have long tails and some will have short tails. And so one thing that schools need to do is actually just to have shorter but more frequent probes on both academics and social emotional, how their kids are doing, because we put a lot of focus on education on big summative annual assessments, which have a key role. But right now, to figure out what students need supports when, we need much more frequent, and therefore to be doable, shorter both academic and social emotional things. And that, one example is that school connectedness I talked about, is just asking how many of our kids do we know, do we have a relationship with? How many of our kids are interacting with other peers? How many are off by themselves? How many of the kids in the classroom, are engaged in some activity beyond just doing their daily assignments? And just those kind of things will give us very quick reads on where our kids are. And the final thing I'll say is it's also very important, just a very micro level, to track attendance, because kids will be doing fine, and then something happens and all of a sudden they miss 4 or 5 or 6 days in 2 weeks. That's when we should be figuring out what's going on, not waiting till it gets to some sort of often bureaucratic number, 10 days, 20 days, 15 days before we do something.
Thanks, Bob. Annette, I see you. Please jump in.
I was just going to just quickly add that I think that we expect our teachers to do it all. They are already doing so much in the classroom day to day. And so when we layer on the role of data manager with all of the other things that they're doing, I think sometimes it can get to be a bit untenable for them. So I do think that some schools have taken the route of hiring a data manager or an educational associate. There are so many different titles for this role, but there has to be an intermediary who can be looking at this summative and formative data and advising in broad swaths the direction of the school. So I think that we need to really think about more broadly how we can get the data out, but how teachers don't have to necessarily be the people who are doing that. As Bob just said, for example, chronic absenteeism has really soared since the pandemic began. And so we do need to get a toehold on how often that's happening at elementary, middle, and high school levels, and get that feedback into classrooms. But I also think that teachers should not be the people who are trying to keep tabs on the data around that. And so there has to be someone else, an intermediary, who can look at this data and make it actionable for schools so that we can have real-time data, but that it's also something that teachers can fold in with what they already have on their plates.
Thanks, Annette. And Megan, I'll give you the last word on this data question before we move on.
I think just building on the comments about chronic absenteeism and again underscoring the interrelatedness of health and education, a lot of times kids are absent because of new or worsening mental health or physical health conditions. So part of the data that is important for schools to be getting, particularly maybe from the school nursing perspective, is what types of new or worsening conditions kids have had during the pandemic and what are the resources they currently have or need to address them.
Thanks, Megan. Bob, I'm going to send this next question to you, although I suspect that some of our other panelists will have thoughts about it as well. But to you first, how serious is the shortage that we're hearing about of teachers and school staff in the United States?
Yeah, so it varies by place, but in too many places, it's really serious. And it has cascading effects, right? So when it's both schools are missing, even 1, 2, or 3 key teachers, then they have to find a short-term solution for that. But then the other thing that's behind that is that it's also been very hard to get substitute teachers when teachers are just themselves ill or have a family emergency. That's in some places that was almost impossible. What happens when that happens, the teachers that are there on their free periods have to cover that classroom, which exhausts them further, gives them no time to build relationships with the kids, or as Annette was saying, anything else besides getting through the day. So the challenge is when you just a small change in your critical mass of adults that are there on a continuing basis and having trouble getting subs can very much discombobulate a school. And it's, it varies by place, but there's far too many schools where that remains a serious challenge.
And if I could jump in here to build on what Bob just said, it doesn't just discombobulate a school, it discombobulates lives. So let's imagine, for example, that in kindergarten at age 5, you decide that you want to be a doctor, like my good friend here, Dr. Collins, and you say, I want to be a helper, I want to be a doctor. That's wonderful, but you've got to make sure that by grade 3 that you're reaching the certain grade level in reading. Well, if you don't have consistent teachers, if you're in a struggling district that does not have strong reading instruction, and your scores are part of the scores that we looked at earlier that are dropping, then you're going to be challenged, right? And so that's going to be an issue. If you have a teacher that doesn't show up in grade 5 when you're learning some of the most important math skills that you'll need pre-algebra, then that's going to further affect you, right? So you've got reading and you've got math issues as you're continuing to get older. By the time you get to middle school, you find yourself in a place where you're not having certified teachers because you're having long-term subs. If you're having long-term subs, you're having subs, or you're having the cafeteria staff or parents stepping in as volunteers to cover a classroom. So those are wide swaths of time, of instructional time, that you as a child who said that you want to be a doctor in kindergarten could be potentially missing. So when you get to 8th grade, the year that it's time for you to actually take some of these placement tests to go to some of our more rigorous high schools, the magnet schools, you may have already missed years of instruction that would allow you to get through the gate. You often hear me, Lainie, talk about the gates. The gates, 3rd grade is a gate for reading. And 8th grade is a gate for math because of the algebra. You need to have algebra most likely by the time you end 8th grade. So by the time you go to high school, when you're trying to be placed in AP courses and advanced courses and IB courses, you have already missed so much because your teachers haven't been there. You haven't had consistent teachers. Your teachers left in the middle of the year. So all of those things, plus having a weekend curriculum, not having a strong literacy curriculum for 9 years from kindergarten to 8th grade, that has hobbled you. So to talk to my colleagues' work, discombobulation, I think that speaks perfectly to what so many of our young people face. And then they get to high school and wonder why they are not ready for post-secondary success. And this is why the teacher shortage matters, because we've got to build a pipeline from K to 12 with certified teachers in every classroom in this country so that our young people have more chances to be successful. Thank you.
Thanks, Annette, for that comprehensive but also very sobering responses. The parent of an early elementary school student, wow, do I appreciate the importance of teachers relative to those foundational skills and how critical that becomes as you move through. So Annette, I'm going to stay with you for a follow-up, and Bob, I suspect that you and our other panelists may want to jump in. So when we're thinking about the teacher shortage, what are your thoughts about potentially finding ways to bring retired teachers back into the classroom, or a different strategy that's been proposed, relaxing teacher credentialing? What do you think?
Yeah, I'm not a proponent of relaxing teacher credentialing because I mean, if you were going to go to a doctor, would you go to a doctor that went on Google to get certified? I wouldn't. And so essentially what we're saying is that the teacher profession is so malleable that we can just walk up to a classroom and start teaching. And those of us who have been in the profession know that it takes training, it takes time, it takes an internship, it takes being an intern under a master teacher to really hone your craft as a classroom teacher. So I think that we need to spend more time investing in people who want to be teachers. On the other end of that spectrum, we need to pay our teachers more. I think that it is just a shame that we expect our teachers to do all the work that they carry every day, and we don't necessarily consider how little in many states we pay them for the work that we ask them to do in preparing America's next generation. So we really should be thinking about this from an economic stance. When we look at the United States and its GDP, what we're building in terms of our next workforce is directly related to what we're paying our teachers today. And that should wake us all up.
Very much agree. Oh, please, Odis, please jump in.
Yes, I just wanted to suggest that how we, I guess, keep our teachers and encourage more of individuals to join the teaching workforce, to understand that we need to also look at the fact that we were losing teachers long before the pandemic. I believe the work of Sutcher and Darling Hammond, if I recall it correctly, suggested that we had a teacher shortage of about 65,000 in 2012, and that teacher shortage increased into about over 100,000, maybe 111,000 if I recall the number, by 2018. And of course, that's pre-pandemic. So there are things that are causing our teachers to turn away from the profession and others to not enter the profession that are related to that trend. And I believe, of course, as Annette said, part of it is the fact that we have not supported our teaching workforce. We've not supported them economically. We've not supported them with the policy environment that allows them professional autonomy, allows them a voice in decision-making. We haven't protected the environment from politicization of education in a way that actually threatens their employment in those schools. There are just a number of ways in which we have not, as a society, valued education and educators. And again, this is a moment for us to really rethink our values when it comes to supporting our kids, not only their educational, but mental and physical well-being within schools as well. Much more needs to be done at the federal level to move the needle on these important metrics that then would revitalize our teaching workforce.
So, Odis and Megan, I know you're wanting to jump in here too.
Well, perfect segue. Before the pandemic, we knew there were these huge achievement and health disparities in our disadvantaged youth across the country. The pandemic brought it into sharp focus, and I think because of the pandemic, we are paying way more attention to this than we had previously. But the problem is we've had 24 months that have been incredibly damaging to so many of our nation's youth. And we now are back in classrooms with an expanded scope of responsibility for our teachers, for school staff, for school nursing, for school health workers, without the necessary infrastructure and support. We already asked them to do everything. Now we're asking them to do everything times two. And I really love the idea of thinking about how do we need to reimagine our education system, recognizing that schools are an important hub for providing safety for kids, food, healthcare services, as well as education. But how do we do this in a responsible way that doesn't burn out our teachers who are trying to do everything plus?
Thanks, Megan. And Bob, before we move on to a different topic, I'll give you a chance to weigh in here as well.
I mean, just to build on everybody and echo it, is that I think it's both creating better working conditions for teachers, better pay, but also just the idea of more adults in schools playing these supportive roles. And that's really part of the redesign, because so many teachers leave. So sometimes it's the pay, but more often it's just the craziness of what they're asked to do without support. And we really have to address both those things.
And Lainie, if I could just very quickly jump in, I'd just like to say that right now, the average principalship is less than 7 years. Yeah. And so looking at the teacher pipeline also means thinking about the school leadership pipeline. And so it's not just our teachers that are in terms of shortage that we have to pay attention to. We also need to think about the school leadership pipeline, because many of our schools also don't have a bench there. And when you look at the majority of our principals leaving within 7 years, it suggests that we have a lot of work to do all along that continuum.
Thanks, Annette. So this next question, this will be a poll the panelists. So I will give each of you a chance to weigh in. Bob, I'm going to send this to you first, and we'll work our way around the Zoom room. Question is, what role can the federal government play here? And thinking about the full range, policies, administrative regulations, legislation, funding, and of course we know that funding increases it can be years and years before we see actual impacts. So Bob, I turn to you first, but we'll work our way around.
Yes, it's funding. And it's also sort of like this is really from our National Partnership Student Success work. It is playing a coordinating role to help getting schools and community organizations and nonprofits and sort of that ecosystem Annette was talking about. But right now there's no organizing force to bring those folks together. And I'll just give you one really quick example to show you where this is falling apart and where there's room, I think, for this organizing role and bringing people together, creating coalitions, putting some support behind them so they can happen. But right now, there are community groups that have tutors and mentors and well-trained, well-vetted, and they don't have relationships with schools. And it's very hard, and maybe they've done a lot of their work at out of school time, and now they want to do it in school time where it's important. All they could do is send a principal an email. The principal gets 1,000 emails a day, half of them from people trying to sell him stuff commercially because of all the federal money they got. And so therefore there's people with supports and a school that needs them and nobody bringing them together. So I think there's a big federal role in there's a lot of resources out there and they're all unconnected and there's no organizing force to connect them.
Thanks, Bob. So sticking with polling the panel, Odis, I'm turning to you next. What can the federal government be doing now?
Well, I think the federal government took a step this past summer when the Bipartisan Safer Communities Act was passed, in which significant amount of resource was provided to schools and really families in terms of mental health services and ways that we can support the whole child within schools. But unfortunately, there needs to be a more comprehensive effort that includes wraparound services, that includes two generational strategies, that seeks to shore up that ecosystem of care within schools to make sure they're supported in learning. And of course, a vital part of that would be the teacher. And so, yes, this is going to vary across states because education is provided by the states, but the federal government needs to provide the resources, the incentive, and the framework. And when I say the framework, one key piece of the Bipartisan Safer Communities Act that I felt was missing was an interest in equity. And when I say equity, I mean the Obama administration had put in play or asked districts to be focused in discipline disparity. And I felt as though that act was a missed opportunity to, again, suggest that is a worthy metric to be concerned with and providing policy support for. Moving forward, if we're going to address COVID and its setback, its impact on kids, there needs to be a national effort with resources that, and Bob is part of that, but a legislative act that identifies resources and in a comprehensive way, dealing with tutoring, dealing with acceleration of learning, dealing with two generational strategies, dealing with wraparound services. That needs to happen within Congress and within our federal government. So I'm still waiting for that moment when our federal government recognizes the enormity of the challenge we are facing with the COVID setback in schools.
Thanks very much, Odis. Megan, next to you for this one. What can the federal government be doing right now?
Well, I hate to forecast negatively, but this may not be the last pandemic that our nation's youth see. And, Annette knows this well. Both of us co-led the eSchool Plus initiative, which was a project we started at the beginning of the pandemic, looking at educational policies across states and across districts in the country, and there was such marked variation. Schools were, imagine March 13th, 2020, schools are all of a sudden told there's a pandemic, you might need to close for a week. 2 years later, we are still digging ourselves out of this. And schools were, in addition to doing all the roles that we have talked about extended beyond education, they're also playing a public health role at that point in time without much federal guidance about when should they mask, when should they vaccinate, when should they open, when should they close, what types of things should they be doing for their students, what types of things should they be doing for their teachers. Schools really tried to figure that out on their own with a kind of patchwork response. And I think our most disadvantaged communities were the ones that suffered the most. So I would love to see a proactive approach that we would start thinking ahead for future pandemic planning and what do we need to be doing to put education and the well-being of kids front and center in any pandemic planning.
Thanks, Megan. I appreciate your pessimism relative to the next pandemic, and I share it. On a happier note, it was a true privilege to work with you and Annette from the beginning of eSchool Plus and to see all that it's become. It's really a remarkable success. On that note, Annette, I will turn to you for a final thought about this question in terms of what the federal government can be doing right now.
I'd love to see, Lainie, an expansion of the federal tax credit and loan forgiveness for teachers. Right now, there is a loan forgiveness program, but it only forgives up to 30% after 5 years in the classroom. And though it does extend to other educator roles like librarian or counselor, I think that any adult who has gone through the post-secondary system to be of support in a school building to a student should be able to get a tax credit. And I think that tax credit could be tiered. We can think of a lot of amazing ways looking at what the Biden plan on student loan forgiveness has been. I think that should really spur some innovative thinking about how we do this. But there needs to be a tax credit that lures people back into the classroom, that lures adults back into school buildings, even our principals. I think that they also deserve a tax credit. Our assistant principals, our coaches, our bus drivers, everyone deserves a tax credit. And we need to think about that because we have to think about how we lure the best and the brightest back into America's schools. And I think that would be a great way to get that ball rolling.
Thanks, Annette. We have several questions coming in that are coalescing around a theme, so I'm going to do my best to bring them all together. When I introduced all of you, I mentioned in each introduction that your work somehow touches on either disparities or inequality. And so the theme that's coming across in the questions we're receiving is what single factor, when you think from a disparities or an inequality lens, are you most concerned about relative to schools right now? And here again, I'll give you each a chance to weigh in because you bring such different perspectives. So I'll reverse the order, and Annette, this time I'll start with you.
I do think it's the staff attrition in education. I'm very concerned because I even see with my own personal 3 children how having a teacher miss significant pieces of the academic year has affected their academic trajectory. And my children are very blessed and very academically gifted. But I do worry about that and how we can expand attracting teachers to the profession, because our most vulnerable children, as I shared in that example earlier, are the ones who are going to cumulatively suffer the most. They are the ones that when you think about how to get everybody to the gate, they need the most support to get to those gates. And having teachers that are uncertified or having substitute teachers, those are not the right ways that we can close this gap. And we know that.
Thanks, Annette. Megan, this time to you. Single factor that most stands out to you when you consider disparities or inequality relative to schools right now?
It's hard to pick a single one, but I think what I would say is we know well that the pre-existing health and educational disparities that existed before the pandemic have substantially widened these achievement gaps. And to Annette's point of what happens in your health and your reading proficiency for 2nd grade, it has a compounding negative impact as you go further along in your educational trajectory. So I would say, trying to figure out how do we address these worsening health and educational inequities in our youngest kids, I think would be certainly one important area. Again, hard to pick here, Lainie, but
I understand. Odis, same question to you. What's the single factor that you're most concerned about right now?
Well, my work has been looking at racial disparities in discipline and in surveillance of kids. So systemic racism continues to be one of the key animators of these inequities within schools. And more broadly talking, it's clear that systemic racism and the dehumanization of certain groups historically is at play in a lot of these pre-COVID disparities that then were exacerbated by the pandemic and remain with us today. So at some point, we're going to have to ask that question: can we achieve effective systems and policies, programs, evidence-based practices within systems that have not reconciled our historic problem with race? And so, with that, I would say that systemic racism and how it really lays the platform for many of these inequities, that is probably, I think, the most significant challenge facing education, past and present.
Thanks, Odis. And Bob, I'll now turn to you with the same question, which will also likely be our final thought for this briefing, given that we're coming up on time.
Thanks. Yeah, so just I would add is that the things where I think the disparities are the most challenging is that because we have this decentralized system in the US of 50 states with their own funding, their own organizational rules, and then within that multiple tens of thousands of districts making decisions, we've ended up with a subset of districts that educate essentially only students that have gone through compounding levels of various types of needs and discrimination and under-resourced experiences for multiple generations. And those schools fundamentally are not designed or resourced for the level of student need and challenge that walks their door every day. And until you change that equation, you're not going to have any kind of significant progress or equal opportunity in locations.
Thanks, Bob. And on that note, I'm going to wrap up and give a big thank you to our experts today: Odis Johnson, Annette Anderson, Bob Balfanz, and Megan Collins. Thank you for joining me. And I'd also like to give a big thank you to everyone who attended this briefing in our audience, and especially to those who submitted questions for our experts. As always, a recording of this event will be made available on this website, which is the home online of the Johns Hopkins Congressional Briefing Series. Thank you.